Perspective versus fear. Each of us needs to choose. As of August 15, 2021, the entire state of Tennessee, deaths reported from COVID-19. 12,941. Even one death is serious. The question is, should I be fearful? That is totally your choice. But to help you, let me just ask, and you may hear the rainfall outside, are you fearful of dying this year of heart disease, cancer, accidental death? Do these cause you concern? Comparison gives perspective. COVID deaths for the entire pandemic for the state of Tennessee, 12,941. This is based on USA Facts, Tennessee coronavirus cases and deaths. Data updated August 15. Cases and deaths for the state of Tennessee, deaths, 12,941. So that's where that figure comes from. When we go to the Tennessee Department of Health and look up the general health data regarding death statistics, this is what we discover. In 2019, the most recent time period available, the death data, that's a 12-month period. Heart disease, 17,083. I want to point out, this is adjusted to 2021 population figures. So we used the 2019 death data, but adjusted it based on the increased population in 2021. Malignant neoplasms, or cancer, 14,625 died in the state of Tennessee. Accidental and adverse effects, 4,937. So, looking at that figure, a summary of what we just looked at. Comparison gives perspective. 12,941 is not based on a 12-month period. It is based on 19 months, the entire period of the pandemic. With that clarification, the last 7 days average daily deaths for Tennessee was 16. There are 365 days in a year. So if we multiply 16 times 365, that would give us the average number of deaths from COVID-19 that we should expect in this year based on this last 7-day period. That's 5,840. 5,840 COVID deaths, state of Tennessee, projected based on the data that we have. This makes it possible for us to have a true comparison, comparing apples with apples. Remember our question? Are you fearful of dying this year of heart disease, cancer, or accident? Well, now you can compare. How many deaths have there been in the recent period of time? Again, from the same site, from June 22 to August 15, the number of deaths, 0 in Ray County, Tennessee. Dr. Ben Carson, the chances of dying if you have been vaccinated is about the same as being struck by lightning. And we don't tell people to stay in the house when it rains to protect against lightning strikes. The Delta variant is very contagious, but it's not very virulent. That means it's not very powerful, like the initial class of coronaviruses that we dealt with. Your likelihood of getting it is very, very small if you've been vaccinated or if you had the disease. The CDC won't acknowledge natural immunity, which is every bit as effective as getting the vaccination. Between the two, about 85% of our population has immunity. We need to be giving people the actual numbers and letting them make decisions. Mandates, that's not what America is about. It never should be what America is about. America came into existence because people wanted to escape from governments who mandated things, who tried to tell them how their lives should be lived from cradle to grave. We cannot allow that. This is the beginning edge of it, and we cannot allow it. Very, very few people are dying. It matters how you present it. There were 2 people who died, and now there are 4. There's been a 100% increase. It's just raging. Or we actually give the statistics, which would show that we really are much better off than we were a year ago. We have to give people the information and let them make the decisions and not mandate things. Concerning the vaccination, and here I'm quoting one of the most influential doctors in the U.S., but I'm not giving his name because he has already been threatened and warned. His life has even been threatened. He's been told that if he continues, he will be removed from social media. Quote, concerning the vaccinations, they are effective. We do not know what the longer-term effects are on those who have taken the vaccination. We do not know the long-term effects of wearing a mask and breathing your own stale air over and over. Each person needs to decide for themselves how to manage their own health. Compare vaccination development. If you will look closely here, you will see that the viral pathogen is listed on the left. There's yellow fever, polio, measles, and so on. The next column, virus discovery year. The next column, vaccine for human use. How many years to find a vaccination? 35, 45, 46, greater than 102 because none is available, 12, greater than 65. And where are we now? We have a 6 months vaccine for COVID-19, the very last listing. We know the long-term effects of eating certain foods, yet we do not mandate that cheese and clean meats cannot be eaten. We let people choose for themselves. We do not mandate that everyone walks for 20 minutes a day. We do not mandate that everyone drinks a certain amount of pure water each day. We know the long-term effects of these things, and we provide information and allow people to decide for themselves. So, you have the right to be fearful. It's your choice. I want to encourage you. I want to encourage you to live a healthy life. Don't wait to take care of your health until you're sick. We are taking vitamin D, vitamin C, and zinc. And the doctor that I referred to, one of the most influential doctors in America, stated that while there have been no studies done, his experience is that every one of his patients that was taking a dose of vitamin D on a daily basis did not get sick and die from COVID-19. I want to encourage you, if you get COVID, get early treatment. Don't wait to be hospitalized. Don't wait to be put on the ventilator. No other disease is treated that way. And I'm pleased to tell you that based on what I know, Ray Medical offers a number of cutting-edge treatments. We need to be smart. We were each created in the image of God and given the responsibility to make choices. In the beginning, God created the heavens and the earth. He created you and me. God bless you as you consider what you will do. Be smart. Take care of your health. It's your responsibility and mine.